This is Dr. Berman, and I'd like to talk to you about something I've mentioned before, and that's the difference between a board-certified plastic surgeon and a cosmetic surgeon. It's important to realize that anybody that uses the term board-certified plastic surgeon has done very extensive training. In my particular case, I did my full medical school, which for everybody is 4 years. And then after that, I did 6 years of general surgery, including an internship. And then I did 2 years of plastic surgery and a fellowship. So it's 9 years of surgical training after getting my MD. Now, not everybody does that much training when they're a plastic surgeon, but they've done at least 6 years. Most of the programs now are integrated. But when you do a plastic surgery residency, which is the training program, you're getting extensive training in all aspects of plastic surgery, not just cosmetic surgery, but reconstructive surgery, hand surgery. And if you're board certified, it means you did both a written examination and an oral examination and presented cases that you've done, and you've also maintained your qualifications. There is no board certification in cosmetic surgery by a medical board. It's just a group of people who've gotten together and they just basically give out this diploma. So it's very important. It doesn't mean they're terrible people or terrible surgeons. They're all MDs, but there's a huge difference between going to your family doctor or some doctor who's taken either no courses or a weekend course or an online course and then decides that they want to do either liposuction or a tummy tuck or a breast augmentation. So it's very important that you ask if this person is a board certified plastic surgeon or just a cosmetic surgeon. Another point of clarification, there's a specialty that is legitimate, which is called a facial plastic surgeon. It used to be called ENT, but as the name goes, it's facial plastic surgeons. So they're quite qualified, and my personal feeling is they should remain working above the neck area. So they're quite fine for, your facelifts, your eyelids, and things like that. And we compete with each other, but it's a healthy competition. They're well qualified, we're well qualified, but they shouldn't be operating, I feel, below the neck area. They certainly shouldn't be doing tummy tucks or liposuction of the body or breast augmentation. Of course, it's a free country. You can do whatever you want, but it's important for people to understand that there's a big difference between a facial plastic surgeon and a plastic surgeon. So I've explained that. So it's also important too, when you're doing things like fillers, who's doing your filler? I always like doing my own fillers. Not all plastic surgeons do that, but for me, it's an interest of mine. A lot of people are going to medi spas, and whoever you get for your injection is whoever they feel like giving you. So like everything, if you have an electrician doing your electrical work, that's who you get. You wouldn't just get somebody off the street. So I find it quite fascinating that people will go to anybody for things like fillers and injections and won't be very critical. Yet if they get their car repaired, they want a car mechanic that's, trained in their car. So I just find there's an interesting disconnect. So those are my thoughts. I think it behooves you to ask if it's a board certified plastic surgeon. You can go to the American Society of Plastic Surgeons. They have a list of everybody that's board certified. And if you have any questions, ask that direct question.